Hi everybody, it's Jessica, one of the physical therapists at Revolutions in Fitness, and today we're going to talk a little bit about breathing, and more specifically the influence of breathing on the nervous system. So breathing is something that happens automatically, right? There's not too much thinking we have to do, but if you do practice controlled breathing, there are effects that you can have on your nervous system and cardiovascular system. And so the way that works is there are two main systems within the nervous system. So you've got your parasympathetic and sympathetic nervous system. The parasympathetic is going to be more active during times of rest, say like when you're curled up with a good book on the couch, and you'll notice that your breathing is slow, you've got nice deep breaths, versus in times of stress, we've got the sympathetic nervous system active, and that's going to be the stress response or the fight or flight response. And you might notice your breathing gets more shallow, more rapid, along with heart rate. In reality, these two systems in the body are always in kind of a balanced state, or trying to get to a balanced state. There's always fluctuations going on, and the easier that the body can shift between these two states, the healthier one is. And the way breathing influences these systems is that controlling your breathing can actually help you control your shift between the sympathetic and the parasympathetic nervous system. So the relationship goes two ways, with the nervous system influencing breathing and breathing influencing the nervous system. So in the next few videos, we'll talk a little bit about how you can implement strategies to increase that fluctuation, or that ease of fluctuation between the two systems, and use that as a way to decrease stress levels and increase the efficiency of your breathing. And briefly, a few ways that breathing can be affected in individuals, say after an injury, is when maybe there's an injury to the rib cage, not allowing the diaphragm to have its full mobility, or the rib cage to expand fully and to allow that full breath. Another way is if the diaphragm itself is injured, or somebody is a habitual chest breather and not utilizing the full capacity of that diaphragm. It can get adhered to surrounding soft tissues, and there are ways we can also work on mobility of that diaphragm to get that full excursion and incorporate a more full breath. So those are things we will also be talking about in the next video, so go ahead and stay tuned if you are interested.